And we're here. Welcome to my future healthcare providers, everybody.
Okay. Hi.
Hi.
Hi. Okay, are we ready? Are we starting? Are we here?
Yes, we are ready and we are here. We're so excited to have everybody here tonight.
Hi, everybody. Thank you so much for signing on and participating in our program tonight. My name is Darlene Thompson. I'm the Career Development Program Manager here at Mary Washington Healthcare. And again, it's very exciting to have you all be a part of our program. Tonight, our focus is on nursing, the wonderful nursing program here at Mary Washington Healthcare. And before I ask our panelists to introduce themselves, I have two very quick announcements to make. So just in case you're not aware of this, I wanted you to know that the virtual Future Healthcare Providers program is a part of a series. Every month, we've been focusing on healthcare careers here at Mary Washington. We have 6 more series to go through this program series, which will end in May of 2021. So by chance, if you are hearing about this tonight from either a school liaison, but you would like to get more information so you can participate in future programs, all you'll need to do is reach out to us, and via email is probably the easiest way. Reach out and just let us know that you would like to get the flyer where you can sign on and register with our program via the Q code. Our email address is careerdevelopment@mwhc.com. And one more time, careerdevelopment@mwhc.com. And you'll see that information again at the end of the program. The other thing that I will very quickly tell you is that please watch the entire program, because towards the end of the program, you will be able to participate in a very engaging Kahoot game. And that's an opportunity for you to win some pretty incredible prizes. So I definitely want you to stay with us and get a chance to learn more about nursing, and then we can sort of quiz you at the end. If you are one of the lucky winners, we will get back in contact with you with some pretty cool prizes. So without any further ado, I would love to introduce you to our wonderful panelists tonight. There are professionals here today that are more than willing to give you some stories and some background and wonderful information about the wonderful career path of nursing. So what I'll do to get started, I'm going to ask each of the panelists to give me their names, their title, how long you've been at Mary Washington Healthcare, and then how long have you been in the field of nursing? Okay, so I'm going to start with you, Jen.
Hi, so my name is Jennifer Searles. I am the medical care educator here at Mary Washington. Years, and my background actually started in fire and rescue, and then I came over, so it was kind of a neat transition.
Okay, I appreciate that. Okay, Caitlin, how about you, please?
My name is Caitlin Cannell. I am the nurse educator for Women's and Children's Care Center at Mary Washington. I have been at Mary Washington for 5 years and have been a nurse for just over 13 years.
Okay, thank you. All right, Mary Jane.
My name is Mary Jane Bowles, and I am a clinical nurse specialist at Mary Washington Hospital. And I tell my new nurses that I work with that I have been a nurse since 1812. I have been at Mary Washington since 1997. And prior to that, worked at several other hospitals. I started as a CNA and then went back to school to get my RN. So, but I'll go into that more in detail later.
Okay, all right. Oh, okay. So we're definitely going to be ready for those stories. Okay, Nancy, how about you, please?
Hi, everybody. My name is Nancy Young. I am the manager of the neonatal intensive care unit here at Mary Washington. I've been at Mary Washington 2004, which is going on 17 years next summer. I could say I've been a nurse as long as Mary Jane, but I think I'm going to let her hold on to that title. But I have been a registered nurse since 1981, so I'm coming up on 40 years this spring. Before I came to Mary Washington, I was married to a man in the military, so I was all over the country doing lots of different things, but found my passion for neonatal intensive care in 1993.
Okay, thank you so much then. And I think what would be really helpful for our students and all of our guests today to understand that, of course, there are so many career paths, as they're connected and related to nursing. So for the sake of this conversation tonight, what we've done is we've sort of split the nursing program into women's services, critical care, and medical surgical. So I'm going to ask you, Caitlin, if you could give us an overview. We'd like to know, what is women's services? What are the populations that you serve? And just tell us a little bit more about what that means. What does that department do? Just anything that you can help us to better understand women's services.
Sure. So women's services encompasses 4 of our units. One being labor and delivery, the second being mother-baby. We have a pediatrics unit as well as a neonatal intensive care unit. So we take care of the moms having babies. We take care of the babies that are sick. We take care of the well babies. We also have, like I said, a pediatric unit. So all the little guys that come in through the ER, anybody under 18 will go there if they're able to stay at our hospital.
Okay, thank you. And I'd like to sort of compare that. So if I'm asking about critical care, Mary Jane, then give us an overview of what is critical care. And you can answer the same questions in terms of populations that you serve. What is that? Help us.
So critical care is the adult world. So Caitlin, they get the little ones and we get the big ones. And so it is, for traumas, we get them as young sometimes as 15, but that is the youngest we will take in our adult ICU. And most of the population is 18 or above. And so we have 2 ICUs. One is medical and one is surgical. And the surgical takes care of our trauma population because we are a level 2 trauma center. We are a cardiac hospital, so it is the open heart patients and the cardiac patients post procedure. And then we have the medical unit, and of course right now, as you students can all appreciate, we in our medical population, we have a lot of COVID patients. And then critical care also encompasses our surgical step down unit, which is they're a little bit too sick to be on the medical floors, but they're not sick enough to be in the ICU. And then we also have 2 general progressive cardiac units. And so those patients are post cardiac procedure, or then maybe just with medical cardiac problems like heart failure. So critical care encompasses 3 general nursing units, like I said, and then 2 ICUs.
Okay. Thank you, Mary Jane. And if we wanted to know a little bit more about medical surgical, Jen, you would be the perfect person to ask. Can you give us an idea of what medical surgical is?
Of course. So basically, we take care of all of the other patients that Mary Jane and Caitlin didn't talk about. So we have, here at Mary Washington, we have actually 6 different areas, 3 medical and 3 surgical, but they 4 medical, 2 surgical, but they kind of all intermingle depending on the patient population and what's going on day to day. But we have numerous specialties, including neuroscience. So we'll see stroke patients and seizure patients. We have an oncology palliative unit that deals with cancer and end-of-life care. We have patients that come in that have dialysis, chronic obstructive pulmonary disease, asthma, as well as all of our surgical patients, which can go from being, joints and broken arms and things like that, replacements, all the way through taking out pieces of parts, such as like an appendectomy, and different things based on what our patients need. Generally, the medical surgical areas usually do ages 16 and up. So basically all the patients that Caitlin's people don't want to keep. we don't like keeping little ones, but we do a lot of different things. So it's a very unique specialty depending on what you want to do.
Okay. So the overview, of course, is very helpful for students. And I'll tell you what would really be helpful as well is if the students would get a chance to have a sort of a bird's eye view. So one of the things that we're going to do next before we go on with questions and answers, why don't we take just a quick pause and allow students to really see what it is to be a nurse here at Mary Washington Healthcare. So we have a very short video, about 3 minutes long, students, where you'll get a chance to see firsthand what these wonderful ladies do on a day-to-day basis. Okay, so let's go ahead and watch the nursing video.
I think that nursing is the most rewarding career there is. My mom is a nurse, actually. She's been a nurse for 35 years, and she has always been an inspiration to me. And when I chose my career, I knew that it sounds a little cliche, but I always wanted to be just like my mom.
I'm a nurse because I'm good at it. And I like taking care of people in their worst moments.
I couldn't picture doing any other career. The challenge it gives you, it kind of keeps you always motivated to know more and be more for yourself, to build your own confidence so that your patients feel confident when you're there at the bedside with them.
We want you to feel like you are part of our family and that you can trust us to take wonderful care of you and your baby. We are a family-centered care unit, and we take care of moms and newborns just during that time after the baby's born for a couple days. Once a mom is transferred to mother-baby, we care for her and the baby as a couplet, and we are going to kind of gauge what her needs are going to be. We individualize everything. We set them up with opportunities for learning. We assist with breastfeeding, with getting ready to go home. Every couplet is assigned a nurse, and we also have the OB/GYN that will come in and see the mom, and we also have the pediatric hospitalist from Children's National. We have great physicians that are here 24/7, which is the big benefit, and they take wonderful care of the babies.
We're the only level 3 neonatal intensive care unit in the region. What that means is we actually can take care of babies that are born as young as 23 weeks up to term or post-term, but we actually have the specialized team that can care for the extreme premature and extremely sick babies that need additional support. The babies that would require neonatal intensive care are those babies that have a delay in transition, they have a known disease process, an anomaly, and especially if they're born prematurely, and they need to literally stay with us, sometimes weeks, months, to continue to grow and develop and provide the nutrition that they need.
Many people view children just as a little miniature adult, and we don't look at them like that at all. We look at them very individually and really have a very special way of taking care of kids.
We serve pediatric patients here in all 3 emergency departments, and they're a special population and they need specialized care and treatment. Some of the ways that we do that is, first of all, is in our approach of the child and how we speak to them. If they're a 2-year-old versus an adolescent, you're going to treat them very, very different. We have a lot of methods to help with younger children and even some of the older children for getting peripheral IV starts. Most kids come into any medical environment fearing the needle, and if we can provide a measure or a means so that they have a positive experience with that, then that puts the child at ease.
A lot of the approach of taking care of the child from an emotional aspect is really getting down on their level. We have all kinds of developmental activities, we have age-appropriate toys, and we bring those things into the room, and actually once they go into the patient's room, they go home with them. We're a 10-bed pediatric unit. Every patient has a private room. The private room also has a bathroom. Every room has a bed that a parent can sleep on. We encourage them to stay, although it's not required. A big part of it is really connecting with their parents and knowing that the parent knows their child better than anybody else. So we always defer to how the parent feels their kids are doing and really look to them to work with us in taking care of the children.
It is absolutely rewarding and highly satisfying to see both firsthand children come in either severe pain or having a seizure or some type of medical condition, and we can fix it.
Seeing that you've had a part in helping a patient go from really being very acutely ill to getting better and going home, it's very rewarding for the nursing staff to observe that and to know that they had a really important part in making that happen. I'm sure that you enjoyed that video. It really makes you think about just how important this role is, and that we are so especially proud of the women that are here on the panel tonight. And I think one way to really engage our panelists is to ask some really deep dive questions. So I have some questions for you panelists, and I'm going to call on each of you. I'd love for you to share some of your stories. I'd love for you to give some additional information to our students about the career path and about, education requirements and salaries and things like that. After we go through our questions together, then I'd also like to open up the floor and give our audience a chance to ask you questions as well. I'm sure they have some specific concerns about the 3 areas that we're focusing on today. So I'll go first then, and what I'd like to know is, I'm always curious to know why people are attracted to the career paths that they decided to embark upon. And I think I would like to start with you, Jennifer. Why were you attracted to medical surgical nursing in the first place? Or tell me a little bit about your background and why did you choose this particular path?
So I've always kind of enjoyed taking care of people and just following that path. So when I was young, when I was only 8, my grandfather actually had shoulder pain, which now as a nurse, I know and understand that shoulder pain can mean a lot of different things. It could be something like I pulled a muscle, or it could mean something like the person's having a heart attack. So unfortunately, this was back in the 80s, and so he was actually having a heart attack. He had seen his doctor that day, but they didn't recognize that sign and symptom of it. So for me, it was kind of knowing and wanting to know those different information. Obviously at 8, it was a very sad experience, but as I grew up and I got older, I realized that one, I liked emergency medicine, and then also just generally the nursing profession itself. So that's kind of the why behind my choice.
Okay. I can definitely understand that and can relate to that then. So the audience, I'm sure, they're thinking about possibly some skills that you would need or they would need to have to be successful as a nurse. So Nancy, this question will be for you then. What are some of the relevant skills that you believe students would need to have if they would like to embark upon a nursing career?
I think that's a really great question for them to be asking, because they're at that stage where they need to start preparing. Once you really get beyond middle school and you're in high school, or you're in that window, you need to start thinking about what do I see in my future? They're so young, they don't know, but it's real important to explore ideas, just like this program is offering. So I think this is a phenomenal beginning for them. I would say the most important thing is to really focus on your schoolwork. Do well. Be a top student, because we want you to be prepared, because quite frankly, pursuing nursing or any of the medical fields, it's challenging. There's a lot of math, there's a lot of science, there's a lot of required knowledge that you have to possess to do these jobs. So a commitment to education is a top priority. As you begin to look at what your path looks like, whether you're going to start out as a certified nursing assistant or registered nurse, or you go down even a further path like Mary Jane and become a doctor of nurse practitioner. So I think that, making sure you're prepared, because I think the hardest thing would be, or a young lady to think, oh, I want to be a nurse, but then they don't take schoolwork seriously, and then they don't have the grades, and they don't have the academic preparation necessary to be successful, in addition to even being accepted into a program where you would be a candidate for learning. So I would say definitely education first. Make sure you have your extracurriculars, work-life balance, have a sport, have a hobby, volunteer, expose yourself to lots of different experiences, because that's the one thing nursing will tell you, is that no matter what track you go on, whether you're in women's and children's, critical care services with adults, that track, whatever you do today is going to help you get to the next level, and making sure every day counts. You know, I've just known enough students over the years where, you know, they kind of slack, they don't do well, and all of a sudden, you know, they don't have that GPA that's going to be necessary to even apply for one of these competitive programs. So take school seriously, and, you know, broaden your horizons, volunteer, look for a mentor, you know, and speak to that mentor regularly. And I'm sure like a program like this will offer that to these eager learners to say, you know, there are mentors out there that can encourage and influence you to be what you're meant to be, and to help you be successful.
Okay, thank you so much. I appreciate that. Thank you. Nancy, since I'm focused on you right now then, and I think this might be a wonderful transition question. So if you're thinking about a person that is exploring, you know, and looking at, you know, beginning a career within nursing, what are some of the different types of opportunities that either we offer here at Mary Washington Healthcare, or just in general, in terms of, you know, once you receive that credentialing, but if you're a brand new nurse, what are some of those opportunities for those new nurses?
Sure. I think that's a great question and a great transition, because, you know, right now I'm just envisioning these successful young men and women that have become nurses. So what next? You know, obviously they want to work, they want to fulfill their dream. And I think the one thing that Mary Washington Hospital can offer is a variety of things. There are residency programs for new grads, you know, and they actually, again, also very competitive, which is why we want these learners to be the strongest applicants and candidates. But the residency programs, I think, are a great way. I know for myself, many years, because I started in one. And so I was introduced to many different areas. And it took me many years to find my specialty, but all that experience built on, you know, what one experience did was built on another and another, and it helps you get to where you need to be. So there's the residency programs. There's also some units, including the neonatal intensive care unit, where there are times when, you know, we want to grow our nurses. So we take those applicants and we interview them, and we find the one or two or three or seven that are going to be, that we believe are going to be successful. They go through an interview process, and they explain to us why they think they want to do that specialty. And then we grow them, and we offer them anywhere from, you know, 3 months to 6 months of training side by side with a professional nurse who is considered an expert in her field. So you have that partnered experience. You'll always have a mentor, a preceptor that you can go to, because when you're a brand new nurse, it's a little scary, it's overwhelming. But Mary Washington builds in that support, so that wherever you are, there will be someone to turn to and go to. So there are the new grad programs, there's the specific residency programs for specialties, and then there are units that will, I call it, grow their own, and start with a new grad and say, yeah, we want you to be part of our care team, and we want you to stay here and become the best nurse that you can be, with the experts that surround you.
Wonderful. And, you know, I guess as our students are thinking about this, and you're looking at it from a full career, so is this a particular career path where there is a typical day? You know, that's always a question that I think students would want to know. Could there be a typical day in nursing? Is there a set routine, you know, in your day? Mary Jane, will you answer that for us, please?
There is and there isn't. How's that for an ambiguous answer?
That's ambiguous. Absolutely. That's ambiguous.
As a nurse, you always start the morning by getting report on your patients and finding out how they did in the previous shift. And then you meet with your team and the physician colleagues, and you kind of plan your day of what you anticipate your day will be with your load of patients, meaning maybe a couple of them are being discharged home. And so then that's a real intensive process, because you want them to be able to go home and succeed at home. You don't want them to need to come back to the hospital. So you have to really give them good discharge instructions, and you have to make sure that they're on the correct medications and that they have the equipment that they need at home. And then there's other patients that come in emergently. And so that's entirely different care that you're giving that type of patient. And so that can really change your day. You didn't anticipate that patient, you didn't plan for that patient, but there's a big car pileup on 95, and so now all of a sudden you have 3-4 admissions coming into the hospital, and where you're going to put them in. So that's a different type of planning. So if you like change, and if you like stimulation, then nursing is the field for you, because although in nursing you learn assessment and of your patient, and then you learn on that, based on that assessment, you have a diagnosis, and then based on that diagnosis, you have implementation of how you take care of that patient. That is very structured, and then you evaluate the care. That is very structured. But in the middle of all that, you can have emergencies come in, or your patient status can change. And so your typical day can become a very non-typical day very quickly. And that's, and I think all the others would attest to that. That is part of the interesting component of nursing, is that it is not, you're from one day to the next varies very differently. It is not the same thing every day, but it's also, for me, that's the intrigue of nursing. That's the fun of nursing. You're always learning. You're always taking something home every single day.
Yeah, the word that I'm really hearing, it's the flexibility there, and it sounds like you all thrive on that, and I think that's definitely what the students need to know. So typical but not typical, but typical yet not typical. Okay, flexible. Yeah, I appreciate that perspective, and I'm sure our students do as well. So I wonder, I'm going to kind of flip back and forth. It's the career development person that I am. We always want to know, and I'm sure my students want to know as well. So if you're looking at, it's probably just the opposite of what I was talking about before, but what are some advancement opportunities that students could have in this particular field? When you look at growth opportunities, when you look at growing in your role and expanding your role, what does that look like? What could that look like? Jennifer, will you answer that one for me?
Sure. So nursing is really a very cool profession in the fact that there are so many different avenues that you can go into. We have people that, they start out as new grad nurses, and then they decide they want to, keep growing. And as Nancy said, we love to grow our own here at Mary Washington. So, they may say that, well, I want to take on more of a leadership role. And so they may become a preceptor and help mentor people, or they may decide that, maybe I want to be what's called a charge nurse or a resource nurse. And so they actually help run the unit and work on the unit and help the unit function and flow the right way, or try the best they can, because sometimes, it just doesn't happen as well as we think it should. And we try to put out what we call fires on the way. Nobody ever has that perfect day. Doesn't matter what job you're in. As well as we have managers and assistant managers, and it keeps going up and up and up in the hierarchy of how the hospital actually works. So there's a ton of different things that you can do. And depending on your skills and what you desire to do and grow into, Mary Washington's very willing to help you get there. We have cool specialties also in the fact that, like, Caitlin and I are nurse educators, or that Mary Jane is what's called a clinical nurse specialist. And so she actually does a lot of kind of behind the scenes works on protocols and different things to make sure that we're using best practice. So there's lots of opportunities.
Yeah, it's surprising to know that you can have all of these different areas within the field of nursing. So that is very encouraging. So now I'm curious, what type of money can you make in the field of nursing? I'm wondering, could we take a couple of seconds to sort of look at salaries and show some diversity in terms of the types of positions and the money that you can make or earn in those roles? So I'm really addressing this to you, Nancy. Can you help us to understand, what can we expect in terms of a salary? Is this a livable wage?
So yeah, did I unmute? Can you hear me?
We can hear you.
Great, good. It has a show. So yeah, and it's interesting because the one thing that I know all of you that are watching today are thinking about is like, well, what kind of quality of life am I going to have? Can I afford a house? Can I afford new cars? Can I, pay back my student loans? And the answer is yes to all of that. Nursing salaries are better than they've ever been. If you look at the floor nurse there, that range is quite a range, and it's based on experience level. But I think for that entry level position, and that newly graduated nurse who might have some student loans, who has literally driven her car into the ground all for 3 or 4 years in college, and she needs a new car, she can actually afford that. And the one thing too, I want to add to this, there's many of our units offer what are called 12-hour shifts, which means you work 36 hours a week, which is 3 days, 3 shifts a week. So you actually have 4 days to yourself for those hobbies, those personal, choices that you want to do for work-life balance. And a lot of my young nurses, and I can think back to some of the brand new grads we had, more than 15 years ago, their quality of life was wonderful because they loved the idea of having those 4 days off to spend time with family or to travel or to, even just do the things that they love doing. So that salary range for the floor nurse is quite strong. But again, if you look at the first number, the 57,000, that is for the new grad with no experience. And I will say that high range for the floor nurse, I know factually that it can even be higher based on years experience. So that's the other great thing. So the next category for the RN case manager, it's a little higher. It's more of a specialty area for an entry level position. But again, quality of life, when you think about what things cost, it's comfortable. And the other piece too that I didn't say, for that nurse who, maybe is a little more motivated, there's often opportunities to pick up a little extra time to even make a little more extra money. Because at the end of the day, it is about livelihood, but we want professional satisfaction. But these ranges here, even for the cancer navigator, as an inpatient, that is typically, a Monday through Friday job. Not always, but again, looking at how you see your future, how you want to continue to grow professionally. For the nurse educators, they typically work Monday through Friday, have weekends off. Many of them are pursuing advanced degrees. They have families. So again, work-life balance and quality of life is something that can be achieved in the profession of nursing. And then the advanced practice roles for those nurses that start out and after 4 or 5 years, they realize that they want to grow, they want to advance their education. Those salaries just increase. What's even very exciting for me to share with you, which I don't think we talked about earlier, is that many of the benefits associated with working full-time at a hospital like Mary Washington is that if you decide you do want to go back to school and pursue an advanced degree, there is tuition reimbursement to help you with that. So Mary Washington wants to help you grow and be the most you can be. And honestly, stay here with us and grow and become that expert, that person, that professional nurse that contributes great things for our community of Fredericksburg and the outlying areas that we serve.
Yeah, that is quite a testimonial. It sounds like maybe, as our students are exploring this field, hopefully so many of them can have career paths similar to, you all as the panelists. I mean, the number of years that you have and dedicated to your profession is so impressive. So as I said, what I hear you saying, and not only are there opportunities to grow here at Mary Washington, and there's opportunities to move up, and your skills and being able to use your education, all of those things really leads to a full career path here at Mary Washington Healthcare. That's what I'm hearing.
Yeah, and I do want to add one more thing to that.
Sure,
just because I've seen it here at Mary Washington Healthcare, is that, for that new grad nurse who starts out and she works full time for 5 years, and then she becomes, she has a family, she has small children. So she goes from full-time and she reduces her hours to part-time so that she can have that quality of life and work-life balance. And once her kids get to a certain age, you know, she comes back to be that full-time associate, or, you know, we adjust to make sure we retain and keep you here and you have that quality of life and work-life balance. Because really, you know, the one thing I will say is Mary Washington Healthcare, we are family. You know, I know Caitlin from when she was in the NICU working side by side with me. I was her manager for a short time and I watched her grow, you know, and now she's back. So it's, you know, the circle of this, I feel the community, the sense of community and family here at Mary Washington is extremely strong. And that's what I want, you know, all of the watchers of this event to know, that if you come here, you're not just going to be a number. You're going to be a part of a family. You're going to be part of a unit. You're going to be part of a department like the nurse educators, the Nursing Center of Excellence. You're going to be in that wonderful elite group with Mary Jane, where we have doctors of nurse practitioner, and you will be recognized for that.
Okay, that is incredible. And it's, as you said, it's a fantastic place to be, and there's so much potential for new grads to move forward and to stay here and grow with us. And Caitlin, this would be a great transition question for you then. So I'm always curious, again, career development, it's who we are. Caitlin, you know, could there be, or has there been something that, you know, I guess when you were looking at this career path earlier, you know, when you were first starting your career, what is something that surprised you early on? What is something that maybe just kind of, you know, stood out that, wow, you know, I didn't realize that was going to be the case? What is something that maybe you discovered earlier on in your career?
Oh, that's a great question. So I think really just that every little thing matters to your patients. Yes, they're there. They may not feel well. For me, being NICU most of my career, it's focusing on the parent as well. But even just asking them how they're doing or getting them some water, it really helps them feel like you are there for them. Like you're not just taking care of a whole bunch of patients, and just making sure that realizing that every little thing matters. Even in the adult world, asking them if they need a tissue, do they need someone to talk to just for a few minutes, just to kind of get their mind off whatever's going on, I really think helps change their path of their stay. And it really helps them to feel like somebody cares for just them, like making them feel like the only patient that they have. I really think that was what took me a little bit by surprise when I first became a nurse, thinking, oh, it's not going to matter if I say, you know, just check on the mom, but she, you know, I said, how are you doing? And then she just broke down and told me everything. And she said, thank you so much for asking. No one's asked how I've been. And so it really makes a big deal. Our NICU actually has a shirt that says where the little things matter the most. And so that's because our babies are usually little, but also I think it's a good thing for nursing that, you know, every little thing matters to people.
Okay. And on the lines of, you know, maybe sharing experiences and sharing stories, you know, in your incredible career here at Mary Washington Healthcare, Nancy, I'm thinking about you again. Can you share maybe one of your most memorable experiences with us?
You know, we have an acronym, TNTC, too numerous to count. There have been so many incredible, memorable moments. And I'll give just a little snapshot just so that the observers of this program can also just think even more broadly. So when I first came here to Mary Washington, I was considered PRN or part-time. But I had lots of ideas. And I know, Mary Jane, you've known me for a long time, lots of ideas, lots of excitement. And even though I was part-time, Mary Washington let me grow even in that role. I had so many opportunities. I worked actually as the NICU clinical educator for a while. I chaired committees. I was exposed to lots of experiences. And during that time, it helped me discover, I think, what I wanted to do next. And for me, what Mary Washington did was it actually, I felt like I was this plant, the seed that they helped grow by giving me opportunities to do things that I didn't imagine myself doing when I first came here. In addition to that, I also, and this is what I want to kind of share this. I through all of my studies and learning and opportunities, you know, I developed a passion for volunteerism. And over the last 10 years, well, actually it's now 13 years, but before I took this role, I was able to actually volunteer internationally around the world. I've been to 12 countries. My focus was teaching neonatal resuscitation, or basically how to save babies at birth, and I did it in underserved parts of the world and countries, including Africa, Zambia, South America, Bolivia. I could keep going, but I don't want to take too much time. But the reality is that my growth here and how I was supported really kind of developed my creativity in my mind and helped me discover really what I wanted to do for that 10 years. And once I finished that, I took the opportunity to apply for the position as the manager. And I believe all those experience helped me do my job every day. So I would say that the most memorable is my time here at Mary Washington in my entire career, where they let me be, I would say, a very creative nurse. I feel like I developed the art of nursing in a variety of different ways, but most importantly is that the circle that kind of went full circle, and that I'm still here and I love what I do, and I have tremendous support from my leaders, is kind of the big story. Is there one event? I mean, there's so many where you save a baby's life, and you go and you pick up a baby from another hospital and by yourself take that baby in an ambulance with one other nurse, and you save that baby. There's little things like that, but to me, it's the big picture. And I can't say enough about Mary Washington Healthcare. When they listen and they care, and they do want to nurture you to become who you're going to be. And that's kind of a blanket, I know, of information, but I really do believe in it, and with all my heart. Otherwise, I wouldn't be here.
Okay, thank you for that. One of the things that I'm sure the students are thinking about would be the educational requirements. And it's interesting, this question is going to go to you, Mary Jane. Help the students and help all of us to understand, so what types of educational requirements are for particular roles? And maybe what would you suggest that the student has in terms of a beginning educational career path, and then tell us a little bit about opportunities as you become more educated. Tell us about what that looks like. Then, of course, tell us a little bit about your experience with that as well then.
So basic entry for an RN to sit for the national licensed test, which is called the NCLEX. That test requires an associate degree in nursing, and that can be obtained at a local community college. And almost in the state of Virginia, most of the local community colleges then have what they call a transfer up program, so that if you graduate in good standing from an associate degree program, you will automatically then be accepted into a bachelor's degree in nursing program at a Virginia State University. Like I said, to be licensed to carry an RN license requires an associate degree. If you want to work in a hospital on an inpatient unit, the requirement is in any hospital in the state of Virginia is that you go on and you obtain your bachelor's degree. That's different if you want to work in an outpatient clinic or in a physician's office. They don't necessarily require, some of them do. You would have to look at the requirements, but for inpatient, for an in-hospital nursing, a bachelor's degree is required. And so that's an additional 2 years on top of your associate's degree that you've already obtained. And then if you want to go on for a bachelor's degree can take you into multiple different fields within the hospital. Bachelor's degree can take you into any any unit. A bachelor's degree can take you into the interventional units if that's what you want, like the cath lab or interventional radiology, the OR. What you often will be required is some additional one-to-one training on that particular unit. So it doesn't, like if you go into the OR, it doesn't require an additional degree. It requires additional in-hospital training within that unit. And then if you choose to specialize, that's where the master's degree of nursing comes in. And the master's degree of nursing is different depending on the role. So if you go master's degree for management, that's usually somewhere around 2 years, 3 years, depending on if you go full or part-time. If you go into an advanced practice role, like my clinical nurse specialist, or advanced practice role would be nurse practitioner, or advanced practice role could be a certified nurse anesthetist that's in the OR, the CRNA. Any of those, midwife, any of those are advanced practice roles. And that requires, on top of the classroom time, that requires clinical hours. So you have to have somewhere around, depending on which avenue you're going into, 500 clinical hours. And those 500 clinical hours are not your working hours. Those are additional over and above hours that you're training for that degree. And then terminal degrees, of course, are your doctorate. So PhD, if you want to go that route, or clinical nursing degree would be a doctorate of nursing practice. And that is then, again, more clinical hours and 3 more years of didactic training. So they all build on each other. So you have to, the basic entry, you have to start with an associate's degree. So what I always recommend is get your associate degree, sit for the NCLEX, get licensed as a nurse, start working full-time in the hospital. Hospitals have tuition reimbursement. Utilize the tuition reimbursement, and then you can go back and get your bachelor's degree. And again, Mary Washington has a really rigorous tuition reimbursement for that bachelor's degree because they know it's required for you. So get that associate's degree and come back in the hospital and have the hospital help you. And then again, the big push for right now is for nurse practitioners, and that's that master's degree position. And like I said, that does require those clinical hours.
Thank you for that detail. That's really clear in terms of helping students to understand just how their education can really build and the opportunities that can come along with those advanced degrees. What I'm going to do then, I am wanting to give the students an opportunity to ask questions. So I'm going to pause on my last 2 questions, and I'm going to go ahead and have Katie to open up the chat because I'm curious to know what our students are thinking. So Katie, if you'll open the chat and let's give our students at least a good 6 or 7 minutes to ask the panelists some questions. And then probably the last minute or so, I'll go ahead and just have a wrap up and get ready for hopefully getting the students ready for their Kahoot game. Okay, Katie?
Perfect. Yes, and I've got lots of good questions.
Okay.
Okay. Our first question is from Cassidy. They identify as a genderqueer pansexual individual, and on average, how often would you think the workplace can be discriminatory against people of the LGBTQ plus community like theirself? And I'm going to direct this towards Nancy because I feel like you've been, I'm so sorry, I can't remember. Someone has been here for 40 years, and I want to say it was you.
So I've been a nurse for almost 40. I've been here
Oh.
at Mary Washington, it'll be 17. But so I have to say that, you know, Mary Washington Healthcare has a very, very strong position on protecting the rights of everyone and being supportive of everyone, no matter how you identify. And, you know, I can honestly say that here at Mary Washington Healthcare, I know nurses from the community that you have, you know, eloquently shared with us. We have, I mean, we are absolutely a very beautifully diverse hospital, and you know, I can tell you that I could name the names, and you know, I'm hoping that their experience is even getting better with the climate that we're in right now, and where we have come from. And I honestly, I think 2020 we're learning so many lessons, and I think that for the LGBTQ community, you know, we can only get better at supporting them in our community. They are our family. They are our family in Fredericksburg, our community members. And you know, I can speak on behalf of my nurses, myself professionally, and the other leaders that I work with, that you know, it is a commitment that Mary Washington Healthcare has made to support all professionals that come here to work with us, that they feel included, that they feel valued, that they are respected, and that if there is ever a moment where they do not feel that way, they have a voice, and they have a voice where they can speak up, they will be heard. And you know, again, as a manager and a leader, it is certainly something that I can speak on behalf of all the other managers. You know, we are committed to always doing the right thing here at Mary Washington.
Thank you for that, Nancy.
You're welcome.
The next question is for Caitlin. I feel like you'll be a good fit for answering this. So it's a two-parter. I'm not sure if it's the same individual who submitted both, but they coincide. So they're torn between deciding to focus in the pediatrics area versus in the labor and delivery and possibly neonatal. And what does the differences in their day-to-day look like for that? And on top of that, what are the educational requirements to become a registered nurse in pediatrics versus labor and delivery?
Okay, so it really depends on what you want to do. I went to nursing school to be a NICU nurse. I knew that that's what I wanted to do, but labor and delivery was always my second favorite department or area, because you get to see babies being born. A lot of people think it's just babies being born and all this fun and lovey-dovey stuff, but labor and delivery is a serious nursing area. They have to make sure that they can monitor both mom and baby and make sure that they know how to take care of both mom and baby. Now, pediatrics are kids. Yes, they're a lot of fun, but when they're sick, they can be really hard to get, you know, to take care of, because maybe they're a really well-behaved child, but then all of a sudden when they're not feeling good, they're not going to listen. They're not going to let you give them their medicine. And, you know, it's just, yes, they're all under the same umbrella, but they're all very specific areas. And for education wise, you need to be a registered nurse. That's all you have to have. Once you're in those areas, each area has their own level of certification. Like for myself, I am a certified registered nurse in the NICU. I sat for the exam and I took the exam and I'm certified. They have that in both L&D as well as in pediatrics. So once you become a nurse, you can just kind of grow in your area, and you just go from there.
Okay, I actually have a follow-up for you as well.
Okay.
So this individual is currently working on getting their CNA.
Okay.
And they're wondering, is there anything in women's services I can do as a CNA while they continue then their education in the part-time, going back and getting their RN?
Sure. So we do have CNAs on our mother-baby unit. A similar position in labor and delivery is an OB tech, but that takes a bit more education and classes to do, but CNA, and then you can grow. CNAs will also float to the other units. They'll float to the pediatrics unit if they need somebody to help with something, or even to the NICU. They'll come over and kind of help with stocking, and they can they'll answer the phones and still kind of see what the process is in the area. But yeah, there's opportunities even in women's and children's for CNAs to help.
Okay, perfect. And then this is just an overarching statement because I'm getting a lot of questions about it. So we typically, Mary Washington does allow shadowing. I help set that up with individuals, and so you can shadow them. It's usually not for more than about 2 or 4 hours, just so you can get an idea of what's going on. And it's also going to vary on the unit, how long they're able to have you on for shadowing. However, due to COVID restrictions, at the moment, we are not having shadowing. I do encourage everybody. I will put in the Q&A section, I'll put my email. Feel free to go ahead and email me though, so that way I can help you get set up once we do have shadowing open. As for volunteering, there are essentially 2 sets. Depending on where you fall, we'll be able to help you with volunteering. If you're in high school, there is a summer program that helps get you set up to do the volunteering hours. So if you can email me closer to March or April and use the same email address, go ahead and give me an email and I can help get you through the process to be a part of that. It's called the Junior Volunteer Program. If you are over the age of 18, you're no longer in high school, you might be already continuing your education, you might still be figuring some things out, and maybe you're working right now. There is what I would say the typical volunteer program. Those volunteers are super helpful. They help with discharges. Everyone loves them when we see them. Brings a huge smile to our faces. They have their vests, so we all know who they are. Go ahead and still email me. I'm not the person to help set you up with either of those 2 programs, but I'll get you in touch with the right people. Okay. Oh, another one.
Katie, we probably have time for maybe one last question before we wrap up then.
Thank you so much. Every single time Darlene has to remind me just because I get so excited. So
yes, she does. Yes, she does.
I will end with this one, and it should be a fairly quick answer. So Caitlin, I'm going to go for you again. How do you suggest going about specifically getting into a labor and delivery unit once you are an RN?
So we actually do have a new grad program, not every year, but if you want to do labor and delivery, many hospitals, including ours, will have a new grad residency program for labor and delivery. And that's very important to be able to get into that specialty area.
Okay, thank you so much. Everybody else, I'm going to put my email in the chat. Please email me your questions. And fantastic panel. Once I have all of the extra questions consolidated, I'll come to you guys for answers and then I'll redisperse them.
Okay. Katie, we appreciate that so much then. And in the essence of time, then what we will do is you can put up the last slide and
absolutely
go ahead and get ready to close the program out. And I'll tell you, if that was an hour, that was probably the fastest hour. There's so much more that I'm sure the students want to learn and to know. So again, as Katie mentioned, we're from Career Development. We're more than happy to help you to stay engaged. We invite your curiosity. We will funnel those questions to our wonderful group of panelists, and we can get those answers for you and keep the conversations flowing. What you have on the screen right now then is some very interesting information, but very quickly, we heard about opportunities and getting your foot in the door and the right thing to do if you're interested in this career path. My colleagues in recruitment asked me to just share with you that there is a position called the Patient Safety Attendant position. We have several openings here at Mary Washington Healthcare. It's a great way to get your foot in the door. It's a starter position for so many other opportunities. But if this is something that you might be interested in, we have our website there. You're welcome to pull up that job description and see if this is something that you might be interested in. If you have questions, reach out to us. Our email address is there again. And then lastly, let me formally thank the panel. We so appreciate your time, your insight, your stories. And audience, if you enjoy this as much as I have enjoyed moderating it, please make sure that we know that, and we will share comments with them. The QR code is on the screen right now. Then we would love to get your feedback on this particular program, for our nursing professionals. So if you will give us some comments and some feedback, and we want to make sure that we can share those comments with our guests. And then lastly, I just want to make sure that you know the Kahoot game will start in just a second. So you have the code there, 09555-873. It's all about nursing. I want to see if you paid attention. So please go ahead and participate in the Kahoot game. We will go ahead and pull up the top winners, and we will provide wonderful gifts for you as well, just for your participation, and again, encouraging you to grow. Panelists, thank you so much for a wonderful evening, all about nursing. I learn something every time I do this program, and I respect you all so much with what you do, and we appreciate your time tonight. And everybody, again, reach out to us. We're more than happy to share more information about terrific career paths here at Mary Washington Healthcare. Okay, so everyone, good night. You all, thank you so much.
Everybody, thank you.
We love the stories. Thank you.
Good luck, you guys.
Good night.
Study hard.